Hello, I'm Dr. Aruna Muralidhar. I'm a senior obstetrician and gynecologist at Fortis Hospital, Richmond Road, Bangalore. Today, I'd like to speak to all those lovely mothers out there, new mothers who were delivered by caesarean section, about how to heal faster and how to improve and enhance recovery. Firstly, congratulations. Being a mother is a huge responsibility, and I'm sure all of you are really doing a great job out there. In general, any healing from surgery is dependent on how healthy you are pre-surgery. So for example, anybody who is obese and has a lot of fat layers in the abdomen will take a little longer to heal, right? So the important thing is to be as fit as you can during pregnancy and not put on too much of weight. Similarly, hemoglobin, that is the oxygen carrying capacity of your blood, needs to be optimal. So those of you who have had a very good, nice, normal hemoglobin through pregnancy and haven't lost much blood during caesarean section are likely to heal faster than those who are anemic. Right? So it's important to improve your hemoglobin levels even before a planned caesarean section or before a delivery for that matter. The third thing is your vitamins, the micronutrients and the vitamins. So they help a lot in healing as well. So anybody with deficiencies, say vitamin D, vitamin C, etc., they help in healing better if you have the right kind of supplementation, the right kind of balanced diet. Now coming to after the delivery, normally what we would do is give you an antibiotic before the caesarean section so that there is no bacteria introduced into the body through the skin. So this preoperative antibiotic does a great job in preventing infections, right? And the second thing that we really worry about, or rather, talk to you about, is about having an early sort of ambulation, which means that as soon as you're, had a caesarean section, we would expect the spinal anesthesia, which is an injection in the back, to wear off within 4 hours, and then we would try to make you ambulate or sort of get up from bed and walk around as soon as possible, maybe between 6 to 12 hours after the surgery. Similarly, early feeding, that is giving you liquids or a soft diet earlier than what it used to be, also helps in feeding and getting back to sort of normalcy as soon as possible. Another important aspect is about pain relief. The more adequate pain relief that we give you, the better your recovery, because you'll be able to walk around faster. You walk around sooner, the circulation is better, the blood supply for the healing process is better, so you would heal faster. So these are all very important aspects of enhanced recovery after a surgery. That is early feeding, early ambulation, that is early movement, and early, more sort of adequate pain relief. Also, the other important aspect of healing process in a post-delivery woman is to hydrate well. If you have enough amount of fluids that you take in, including water and other fluids, the circulation is better and the healing process is definitely much more better. There are some cultures who feel that the new mother should not have enough too much of water, because that would cause water retention or swelling in the feet, etc. But that's definitely not true. In fact, a good hydration will go a long way in improving the breast milk supply, in improving the circulation, and in having a normal sort of easy motion as well. So hydration is extremely important as well, right? We also do give blood thinners to women who have had a surgery in the postnatal period and those who are obese, in order to improve the circulation and avoid blood clots forming in the veins. So that is something that we take care of while the woman is in the hospital. In the older days, not very long ago, women would stay for about 5 days in the hospital. But we in Fortis strongly believe that an early sort of discharge from the hospital by about say 48 to 50 hours would help in the woman sort of getting back to health earlier. Of course, if everything else is normal with her and her baby and the recovering process is good, as well as the breastfeeding process is established. So following your discharge from the hospital, again, it's important to have regular balanced meals, take all your supplements, hydrate yourself well, keep yourself, active and ambulatory, and also come back for the 7 to 10 days post delivery follow up, as well as the 6 weeks follow up. Because normally the 6 weeks follow up is when your body comes back from a pregnant state or a post pregnancy state to a completely normal state. And at that point of time, if we institute the right kind of postnatal exercises, your weight, you will be able to reach your ideal body weight faster, and that will avoid a lot of other issues with health, including joint pains and body pains, backache, etc. So postpartum fitness is extremely important as well for long-term healing. So with that, thank you very much and wishing you all a very happy motherhood. Thank you.